Hello friends, today we will see about straight self-expanding metallic stent placement for a patient with a malignant tracheoesophageal fistula. As you can see from the video bronchoscopy here, there is a presence of bulging of the posterior tracheal wall with the infiltration of the tracheal wall by the tumor with a malignant tracheoesophageal fistula. Now we are planning to close this with the help of a self-expanding metallic stent. This is how a self-expanding metallic stent with a loader looks like. Initially, we unlock the screw and then we test if the loader is working properly or not. As you can see from the video here, as I am pushing the lever, the stent starts opening. And once I know that the stent is now properly functioning, I will be deploying the stent under the presence of a C-arm guidance. Now I will be deploying the self-expanding metallic stent under direct bronchoscopic visualization and C-arm guidance. I am passing my bronchoscope by the side of the stent deployer through the rigid bronchoscope, and you can see the stent deployer entering into the trachea. And once I know that I am above the carina, now I start slowly deploying the stent under the C-arm guidance. C-arm plays a very crucial role in determining the proper stent placement. So I pre-mark the carina as well as the distant margin of the deployment of the stent to make sure that the stent sits in place. And as you can see from the C-arm video here, the stent slowly starts opening up. And this is again reconfirmed with the help of a direct bronchoscopic visualization. Generally, we use these single-use scopes so that our routine scopes doesn't get damaged. And you can see that the stent is gradually opening up and the stent is getting deployed with the help of the bronchoscopic visualization and the C-arm guidance here. And now the stent is completely placed and it has opened up inside the trachea. And post stent, now I am passing my bronchoscope to visualize the position of the stent with respect to the tracheoesophageal fistula. It looks fairly good, but however I need to pull up the stent a little bit. So what I am doing is I am passing my rat tooth forceps through the working channel of my bronchoscope and holding the thread which is available at the proximal end of the stent to pull up the stent. And once the stent is gradually pulled up, making sure that the stent doesn't get displaced, now the stent has reached its appropriate location, and now the post deployment bronchoscopy shows a perfect placement of a self-expanding metallic stent for the closure of a malignant tracheoesophageal fistula. Thank you.